Hi, I'm Dr. Fritz. I wanted to give a quick example of how you can use ion pumping cords with extraordinary vessel treatments, but then also some more common acupuncture point combinations. So we're going to do a treatment on this young lady. So I'm going to take her pulse. Okay, and it's a little bit, it's very balanced, a little bit wiry. Okay. And then I'm going to do a Hara palpation. Okay. And I can feel some tension in the subcostal area and the abdominal area. Okay. So we can just do a 4 gates treatment with ion pumping cords. So I'm going to start with her right LI4, and in Japanese the Hagu, or large intestine 4, is a little bit closer to the junction here. Okay, so take a deep breath in and then relax it. We're just going to do that. Let it relax. We'll go through and do that. Now I'm going to switch over and do the left liver 3. And again, this is a bit closer up to the bone. I'm actually going to have it go towards. Does that feel okay? It's good to check in with the patient. And then just breathe into it. And then we're going to go into our left LI4. And the right liver 3. So it's a very superficial needling. All right. So then we're going to use our ion pumping cords. Okay, we know that the black is the master and the red is the coupling. So you don't want to cross the cords at all. And because of the superficial insertion of the needle, it's normal to tape the needle down. Okay, so I'm just going to tape it down. So then I don't have to worry about it coming out or coming off. This is tape that is appropriate for skin, and so it doesn't create a strong adhesion, but it is strong enough to hold that needle in. Okay. You'll also see techniques where instead of holding the needle in, you could also tape the ion pumping cord. Okay, so based on that, we're going to put in the black, and I like this one because it kind of pinches the needle head, and we'll get a close-up of that. And so we're going to just put a black one here, and let's actually start. We can start with the right. I just want you to be able to see it. Okay, and this will just kind of hug the needle and let it sit there. And red goes to, yes.
Clenching off like.
Is clenching off what?
It's like
That's okay. So the cord is just going to touch a little bit. You want to let the patient know that the cord's going to touch there. You don't want to have it you don't want to have it dragging off the table, because a lot of times you'll walk by and pull it out, and that'll be shocking for both you and the patient. But that tape really allows you to do the cords with confidence. Then I'm going to do the same thing on the left side. So the black is going to go to LI4. Okay, and the red to liver 3. Okay. So this is the first step of Yoshio Manaka's ion pumping cord treatment. So we're going to let that sit for about 10-15 minutes. Okay. And then the next step would be to take these out and to do the liver and the large intestine shoe points on the back, either with needles or with several rounds of Kyoto Shin Moxibustion. And then it's appropriate to, again, check the hara and the pulse and to do an adjunct treatment of some kind. So some ear acupuncture, some regular kind of TCM needles to just even everything out. And that is a simple ion pumping cord treatment with 4 gates and ion pumping cords.